Hi, I'm Paris, and I've really got to pee right now, but I'm not going because I'm in the process of retraining my bladder. Now, this is all a result of radiation treatment I had for prostate cancer back 1.5 years ago. And as irritating as it is to have to pee all the time since I had that treatment, what's even more irritating is that no one in the medical community I've interacted with has suggested I try bladder retraining. I started a couple weeks back and I've already seen some pretty good results. Now, I'm not a medical professional, have no medical training. I just have my anecdotal experience of having gone through 9 weeks of radiation for prostate cancer. And when they zap the prostate, right through the middle of the prostate is your urethra that carries the urine. Also right along each side of the prostate are the nerves that control the whole system and trigger the opening and closing of things. So it only took a week of daily radiation treatments before it started, and it is this spasmy feeling. You can't quite tell where it's coming from, somewhere from the bladder, the urethra, the sphincters in there, somewhere in there you get this of the spasms going on. Also the nerve irritation, so that your bladder sends a message to your brain like, oh my gosh, we're going to burst. You got to get to a bathroom right now. But when you go to the bathroom, it's like, what are you talking about? We're going to burst. That wasn't nearly enough to cause bursting. And it was day after day, 5 days a week for 9 weeks of doing that. There may be some residual damage, but I have still had the issues with the spasm and the you gotta go pee now and the very frequent peeing about once an hour, day and night. So I'm up, it's closer to 1.5 hours while I'm sleeping, but still it's an awful lot of peeing. The problem is I've developed a bad relationship with my bladder. My bladder tells me what's going on rather than me telling my bladder. So I have to plan my day around knowing that I'll have to go to the bathroom that often, and if I'm driving somewhere, that I'll have to be able to stop. People who have the frequent urination issue, you gotta cope, so that's what you do. You learn where are all the places in a pinch that I can run to and pee. It's inconvenient, but I deal with it. Now at night, it bothers me a lot having to get up out of bed every 1.5 hours to go to the bathroom. I don't feel like I get that contiguous sleep. I know having the disrupted sleep is bad for the health, and so it's been frustrating to me that other than a recommendation for a medication that helps to empty the bladder more fully, which isn't my issue. I did try it. I didn't see that it improved things very much, and it also gave me some heart palpitations, so I stopped that. But I didn't know that there was such a thing as bladder retraining. Now, why is it retraining? Well, you did train your bladder at least once before in your life when you're a little kid. While you're wearing a diaper, just let it go anywhere, anytime. But when it's potty training time, usually when kids get to around 2.5 years old, they're able to hold the pee in. They don't want to. I've potty trained my 2 kids, and it took a few weeks of some accidents and some fighting back against it, but they got the hang of it. They trained their bladder. When I was a kid, I trained my bladder, and that training lasted me for decades, but that stress with the radiation treatment and the irritation and, oh, am I going to be able to hold it or not? And the whole mindset. Anyway, I lost my training. I basically got, so when my bladder is maybe 25 to 30% full, it starts ringing that alarm bell, you gotta go right now. And so I do, which then keeps the pattern up. So when it gets to 30% again, I gotta run and go, and that's why I'm peeing all day and all night. Now, to retrain it, I don't remember when I got potty trained, but I'm sure it was uncomfortable, and I can tell you that doing the retraining is uncomfortable. I have had to pee since I started this video, but I'm waiting on it. And let me give you some objective numbers here. Most people, when they pee, the amount they pee at one time is between, I think the normal range is 250 to 450 milliliters. So they go when their bladder is about 70% full, compared to me going about every time it gets up to 30% full. That's why most people can last 3 hours or so between times when they have to pee during the day, and they only have to get up once, maybe twice at night. Now, bladder retraining is an accepted medical intervention in this situation, but nobody mentioned it to me as an option. So when I found online, hey, this sounds like it could work. Sounds awfully uncomfortable, but sounds like it could work. I decided to, well, I read more and more about it, and there are physical therapists that you can go to if you need this that will take you through it and support you through it. So there are different things you can do. You can keep a log of when you pee and how much. You can set up a schedule and then try to increase the time between when you're urinating. There are exercises you can do to make the muscles there stronger, and part of it though is just getting past the mental block of thinking, oh my gosh, I need to go, or I'm going to wet myself. You've got to be able to get past that. And for me, that's the hardest part. But the basis of a lot of bladder retraining seems to be trying to extend the time little by little between when you get up to go pee, and forcing your bladder to wait a little bit longer each time. So they want you to have a set schedule through the day. And there are other elements to it, which, look it up if you're interested, ask your doctor about it. In my case, when I'm drinking some tea in the morning, and I drink decaffeinated tea to not irritate the bladder, I know I'm going to be peeing more often because it tends to go through me. Other times when I'm not having anything in the afternoon, that I know it won't be as often. So anyway, I didn't care for the idea of having a set time, set interval throughout the day. I would rather do it by the amount of pee I produce. I want to be able to stretch that bladder out a little and make it so the nerves don't go screaming when it's only at 30%. I want to bump it back up into the normal range, make my daily life a lot less complicated, and I might get some blissful 3-hour blocks of sleep. So that means I measure how much I pee into a measuring cup, and I'm thankful to say, progress. When I first started, more than a week ago, measuring how much I pee each time, it was probably the average was about 120 milliliters. The longest I could last without going was to get it to 150. And that was, man, I am running to the bathroom with the feeling that I absolutely have to go. I couldn't get it past 150. Again, normal is at the low end around 250. So this is where we get into a discussion, not a scientific discussion, but developed by my brother. Back in our youth, we would talk about these things. Kids always talk about toileting things. And so he developed this theory that when you had to poop, and you couldn't, so you would kind of hold it back. So you would have basically the contractions, and you would put a stop on it, but then they come back again. 20 minutes later or so, you get another wave of them, and they're a little more intense. So these are the squeezies, and my brother's theory is that it'll go all the way up, the number of times it will happen is all the way up to 7, but no one can last the 7th time. The 7th time you have the contractions of the bowels telling you it's going to happen now. It happens then. You can hold it back. If you're good, you can get all the way through 6, but man, that's a point of desperation. But the 7, nobody can do 7. So this was the theory developed by my brother, and I would apply it to the spasms that come in the waves too, with feeling like you have to pee. Because you get that, at least in my case, it just kind of comes on me suddenly. It's like I don't get a warning that, oh, your bladder is getting full. It's like, and it's often when I'll move, change positions or stand up, and it's like, now, we must go now. And everything is, and you got to fight back against it. If you can ride that out, see, I hadn't really been working on riding it out. When it told me to go, I would run and find a bathroom and go. So if you can ride it out, then the spasming lessens and the urge reduces, sometimes for a couple of minutes, sometimes for 5 minutes. Phone just rang. I left it out in the other room. I had to get up. To answer it. And sure enough, within a few seconds after getting up, wave 3 of squeezies hit me. So it's still going on now. 3 is about as long as I can usually last at this point. Okay. So I started this actually 2 weeks ago, and in the first week, so let me tell you the progress that I've seen. I'm going to try to break my record here. My average amount of urinating at one time was between 100 and 150 milliliters. Couldn't get past the 150 for about a week, and so I was holding as best I could, but then I'd be worried, I'm going to have an accident and run. But I found now I can get through the first wave, I can get through the second wave. The third wave here is stressing me out. But at the end of 1 week, when I would push it to the limit, I got up to 200 milliliters. Now 250 is the low range for normal, so that's my goal. But it's going to be some more work getting there. Now, last week was kind of taken off because we had a big ice storm here in Austin. The power was out here at my house for 3 straight days and nights. So it was survival mode, and especially when it's so cold, it's even harder to to stop yourself from having to pee. Okay, I think we've reached the limit here. I'm going now. 220. Broke my record. All right, I'm going to be a normal person again. So this process can take 6 to 12 weeks because I'm finding I'm able to push how much I can pee at one time, but it's not getting easier to be able to do that. If I were sitting at a table with other people pounding on the table, they would wonder what's going on. So I need to not only be able to push the number up into the normal range, it needs to become more comfortable. And I don't know if it'll ever become completely comfortable again. I'm not sure the state of all the nerves and the muscles after all that radiation, but I know I can improve it. And I'm pretty sure if I keep doing this, just like when I was originally potty trained, it'll get easier and hopefully even become second nature. And as I mentioned, I tried a pill to help with this that really didn't help and had its side effects. I know there are surgical options about this, and again, I have no medical training, but I have found for me early in the process that I'm really having good luck getting back in charge of my bladder with bladder retraining. I'll update you about this in 6 to 10 weeks, whether you want to hear about it or not, and I'll see you on the next review.
There are so many choices and you don't want to stress. You want your health food at home, receiving only the best. That's what we're here for, we give honest reviews. parristx.